Okay, good morning, everyone. My name is Alicia Cerrato. Thank you for joining the session. Today, we are going to speak about the capacity development approaches for COVID-19, and we are going to speak about the experiences from Honduras and El Salvador. Um, I will start with a quick question. How long will it take to prepare to climb Mount Everest? Just for everyone in here in our room to think about it. This is a not easy task, lots of energy and resistance is needed, and huge risks are taken. So preparedness for many months is required. In our case, with great challenges and amidst a global emergency response, the same question was rephrased for our context. How long does it will take to prepare the frontline healthcare worker in the COVID-19 management so we can tackle together? The difference was that we didn't have any time to prepare ahead. So as the pandemic started, back in March 2020, with our first reported case in Honduras, we have a significant surge coming after in the following months, straining our health system. We realized that we only had about 16 critical care specialists for a country of 9 million people. So, as never seen in history, all general practitioners and non critical specialists were redistributed into newly installed COVID-19 wards. So as more critical care patients were admitted and respiratory support was required for those severe cases, in June 2020, 210 ventilators were donated by the US government to our Ministry of Health. And we helped them with the distribution and allocation of these into 25 hospitals nationwide so that respiratory support with non-invasive mechanical support was offered. On July 2020, HP Plus also assessed 21 COVID-19 areas, and impactful numbers came from this assessment. More than 50% of our hospitals didn't have trained physicians on mechanical ventilation, and more than 70% of them did not have any policy documents from the Ministry of Health. And the most impactful number was that less than 1% of our nurses were actually trained in critical skills. So our main priority was to focus on providing technical assistance. While we all know that the equipment is necessary and the critical care patient relies on the proper use of this, it will be definitely of uncertain use with the appropriate skills and clinical management standards and trained providers. So for this, HP Plus focus strategically on strengthening capacity. As you can see in your slide, from July to December, we started with our first virtual and in-person trainings as lockdown has been established in all the country. So we have a hybrid model in which we recorded videos and a person was at the different facilities providing enhanced sessions. To date, we are still doing the simulation trainings through hybrid models. So in this scenario, a capacity training model was developed based on critical care focus skills previously identified, as I mentioned before. So next to the identification of priorities, we proceed with something very crucial, which was the stakeholders engagement, identifying key actors from the Ministry of Health and some other private sector associations that will help us in the sustainability of these actions. One was the Critical Care Honduras Association, medical and professional nurses, and some other USAID implementers such as EPIC and PSM Chemonics. After that, as I mentioned before, virtual and hybrid models were developed by our team, and we started providing these training sessions through replication process all over the country. Here you can see a picture on your side of how we provided virtual and you engage people through Teams meetings and HP Plus recorded videos. Then we distributed PPE sets so that someone can guide the different trainings in person. And we started with this pilot practice that eventually replicated nationwide. An important number is that we have coverage and impact of 100% of the health regions in Honduras through this replication process, and it still continues to date. Also, something that I want to highlight is the knowledge improvement. We have come through with pre and post test, and we are knowing that finally better outcomes were expected from these technical assistance, relying on the quality of care for our patients at the end of all these trainings that were provided. So this is my last slide. The high-level outcomes are the stakeholder engagement that was crucial for our assistance. We developed several documents, the home-based care guide, the vaccine, COVID-19 vaccine distribution administration and adverse events guide. We also have an IPC guide, and we are now working on a long-haul COVID document that will also be adopted as a policy and implemented nationwide. Best care and evidence-based practices were implemented through these actions, and we are guaranteeing sustainability of this because of the engagement of specific stakeholders nationwide. I will hand over now to my colleague, Dr. Reynaldo Flores, who is our regional senior technical advisor, and he will speak about the El Salvador experience now. Thank you very much. I will be happy to address some questions at the end of the session.
Good morning. Thank you, Alicia. It's a privilege for me to share with you the experience on telemedicine as a tool for clinical training and patient monitoring. The pandemic found El Salvador in very bad shape. You can see a photo of February 2020 of one of the public hospitals that we have in San Salvador, overcrowded with very few distance conditions and also very few personnel in the health sector attending the hospital and the patients. So we had two problems to avert the upcoming crisis, and it was urgent to increase ICU bed capacity and the reach of critical care specialists. And how we did that? El Salvador decided in March 2020 to build a new hospital, 500 beds for ICU. And in August 2020 was ready, and the government requested HP Plus to help in the strategy for monitoring the patients that start to come in huge numbers. And what we have done is to develop telemedicine for monitoring the patients, meaning that each physician in El Salvador and the new El Salvador hospital will monitor 10 patients on average. And the ICU specialists that were very few in El Salvador, as well as where they were very few in Honduras, they will make the rounds and supervise the activities of the physicians. But also we need to train those physicians on the fundamentals of life support for COVID. So 982 health professionals in the first phase across 9 hospitals in the metropolitan and central region were trained on telemedicine and for monitoring the personnel as well. In February to December 2021, we developed 2 new modalities. We upgraded the training that we had before, and we had 2 activities very important. Number one in-person training for hospital staff, 502, to cover the rest of the hospitals in El Salvador, and a remote course for 45 health professionals. It's important to underline 2 things here. In the remote course, we had the presence of colleagues from Honduras and Guatemala in this training. And the second important aspect is that with the help of other cooperating agencies, we get the infrastructure for training within the new hospital. So Japanese cooperation, Luxembourg cooperation, and Korean cooperation gave them the resources for building the infrastructure, and HP Plus provided equipment and mannequins for establishing this laboratory of practice and for the training in the hospital. Now, this is the last slide that I should call it next steps and sustainability. And 2 things are very important. Number one, HP Plus continues supporting the leadership of El Salvador National Hospital to build critical competences at the national level. These competencies include monitoring of intensive care cases related with COVID and other infectious diseases, because we are planning to promote training on critical competences in emergency situations that require intensive care. The second thing, very important, is to establish El Salvador National Hospital as a regional training hub, collaborating with public hospitals in Guatemala and Honduras to develop regional capacity in clinical telemedicine and critical competencies. In this regard, as we talk now, El Salvador Hospital is in the process of becoming a WHO collaborative center in telemedicine, and also to submit a grant proposal to Inter-American Development Bank to continue supporting this. This won't be possible without the investment in human resources and equipment and infrastructure that we already have. Thank you, and I'm ready to take questions.
If there are no questions, are there any last points that either of you would like to highlight, since you had to rush a bit?
Yes.
Yeah, we just wanted to highlight the importance of the stakeholder engagement in order for guarantee sustainability of our actions. We usually come to help different countries and ministers of health and governments, but I think that it's important to identify who are the other donors and, open our doors into a co-creation of the plans so that we can actually, focus on the priorities for the ministers of health. And after that, then work together. So I think that that will be crucial, not only
Yes.
for the country, but also for Central American or the region, focus. And
Okay.
thank you very much.
Thank you very much, both of you, for that great presentation.